Hi everyone, Angie here. Welcome, welcome, welcome. Right, so today's question I have for you all is, can you catch gonorrhea non-sexually? So it's in relation to an article that was printed in the Daily Mail recently around an 11-year-old girl who contracted gonorrhea whilst on a family holiday from a hot thermal spring pool. So I'm going to put the article title up for you to have a quick read, and then we're going to get into discussion points around this and what my thoughts are around this, and hopefully you guys can get involved as well. So here's the article for you to have a look at. So to recap it all, it is based around an 11-year-old girl, or she's a child, should we put it like that, because that's what she is a child, went on a family holiday to Italy. Not that it really matters where she went, but whilst out there, she was bathing in what we call like a hot thermal spring pool, and she unfortunately contracted gonorrhea whilst out there. Now, it's believed that that's because she shared the same body of water with somebody, an unknown person, who was positive for gonorrhea at the time, and as a result, this young girl has unfortunately now contracted gonorrhea. Now, the kind of science behind it is that because this hot thermal spring pool is a very warm temperature, quite similar to body temperature, it's like a perfect breeding ground for the gonorrhea bacteria to thrive and survive, and that's how they believe it may have entered her body, allegedly. Now, as I was reading this article and I saw the title first, my initial reaction was, this is rubbish. How can this happen? No way, nonsense. This child's been abused. Nah, I'm not having that, basically. All the red flags were going off for me. But then on the flip side, I was like, well, actually, can this happen? Is there such a way of contracting gonorrhea in a non-sexual way for a child? So I started doing some digging and reading and a bit of research around it. And I do have to say that it was actually really difficult to get a definitive answer as to whether this can happen, because it's just so rare for it to happen. And all the papers that I was coming across were so old and dated for that reason, because it's so rare for it to happen. But I did come across some quotes and some articles from professionals around their thoughts about this subject. So I'm going to put this to you and read them out. And again, we're going to sort of have a discussion around it and go from there. Okay. So the first quote is from a Dr. Edward Brooks, and he is a specialist in infectious diseases at Stanford Healthcare. Now, as you know, Stanford is one of the most prestigious establishments in the US, and he says that there is no evidence that an individual can get an STD from casually swimming in a pool. Transmission of STDs through a hot tub or pool are only possible if two people are engaging in sexual activity whilst in the water. I then went on to read again and did some more reading and searching, and I found an article on the National Library of Medicine, and it stated that authorities do need to recognise that while it is rare, gonorrhea can be transmitted non-sexually and should not be presumed definitive evidence of abuse. So it's a complete opposite thought to what the first professional was saying. I then went digging again and found a third article, and this is from the American Academy of Pediatrics. Now, they stated that non-sexual transmission of these infections is an infrequent occurrence, and when they affect the prepubertal child, sexual abuse must be highly suspected. Now, if we go to our own website, the NHS website on gonorrhea, it states gonorrhea is a sexually transmitted disease infection which is passed between people through unprotected vaginal, oral or anal sex, or even the use of sharing sex toys. Further down, it goes on to say gonorrhea is not spread by kissing, swimming pools, hugging, toilet seats, cups, etc., etc. So those are four different various views and perspectives in regards to this whole situation. Now, here's my view and where I stand in it. As I was reading the article, a few things stood out for me. The first thing was it stated that 2 days after the child had been exposed and was bathing in this hot spring thermal pool, she started complaining of symptoms of, the burning, the stinging sensation, and that kind of alerted the family to take her to get sort of seen out there by the doctors. And that's when they performed, the testing, and, as we know, it came back positive with gonorrhea. If I'm going back to like my sexual health days, I know that gonorrhea has a 2-week incubation period. So for this child to now be just complaining just 2 days after being exposed to potential gonorrhea in this thermal pool, it kind of indicates and alerts me that she potentially already had gonorrhea before coming on this holiday. Another thing that sort of brought to my attention was the fact that both parties, so the child and the family, were then asked by, the professionals out there, is there any way whatsoever that there's been any form of sexual contact with this child? Both parties adamantly denied that this is not the case. And I kind of thought as I was reading the article that just because both parties adamantly denied it, it was kind of like brushed off and, put down to, okay, so she has potentially, contracted gonorrhea through this thermal pool. Now, here's my thing. If you're dealing with potential sexual cases with children, they probably are most likely going to say no and deny it because they may have been threatened or intimidated. If you say anything to anyone, they might harm someone who's particularly dear to them. It's our little secret, that kind of thing. So to then put it on a child is a very sensitive topic to be discussing and questioning. So they probably more are likely to say no if that is the case of any sort of threat or intimidation or they're feeling scared. Another thing that came up in the article is that, all the other members of the family came back negative with gonorrhea, even though they were in the same pool of water in quite close proximity, but yet this child was the only one who came back positive with gonorrhea. So that for me also raises a few questions for me. So then I start thinking, okay, so what do we do as professionals if an 11-year-old child comes to us in a professional setting and says, they've contracted gonorrhea or any STI, what would we do? And for this, I don't even actually think you need to be a health professional that works in health and social care to even have a guess or have an answer, because we should all be looking out for vulnerable children amongst us in society, because that age-old saying that safeguarding is everyone's business, and it really is. We all should be having our look out and our eyes out for them. So what would we do? First of all, you want to have a good listening ear. You really need to be listening if a child discloses something like this to you. You cannot go in with this whole, what did you just say, kind of thing. If you go in with that shock horror, that will completely cause a child to shut down and you will not get anything out of them going forward. So it's really sensitive and really careful situation to be a really good listener and document everything that's, being said. With that being said, in terms of documentation, I personally don't like typing away on my laptop or writing down on my notepad every single thing whilst this is going on, because can be quite distracting, especially for a child, when they know that you're tapping away. So I do let them know, but I'll be making some notes. But however, I would save the bulk of the writing and documentation for after the child has gone. You definitely want to be contacting social care and doing a mass referral and, writing down what your concerns are and what's been said. And you definitely have to be contacting the police, because here in the UK, a child who's 12 and under cannot consent to anything of any sexual nature, whether it's oral, penetrative, anything like that whatsoever. It's a criminal offence. So the police definitely have to be involved. Possibly requesting a CP medical. You want to be discussing that as well. And a CP medical is like a head to toe body, look at the body, and they'll be looking for evidence of any sort of redness, any swelling, any bruising, any sign basically of sexual contacts that could be used in potential evidence. It's really important to get that done very quickly. There are amazing services out there such as the Haven, who deal with delicate issues like this in terms of gathering evidence should they need to. So yeah, those are my recommendations and my viewpoints of how I would handle the situation. Let me know how you would handle the situation, what else you would add. What are your thoughts? Have you ever come across this before? What did you think of the article? So yeah, thank you very much for tuning in. Don't forget to subscribe, share, let me know what your thoughts are in the comments, and I will see you next time with another weird and wonderful question. Bye.